My name is Dr. Sumit Anand. I'm a board-certified psychiatrist who has a private practice here in McLean, Virginia, and I'm also a healthcare partner with Kygo. I've been practicing clinical psychiatry now for the last 23 years. I got into it because I was fundamentally interested in the human condition. The typical patient I would see in this practice is typically highly educated, very accomplished, yet probably struggling internally with something. They are usually of a demographic that they are able to be successful in many areas of their life. They can pay their bills, they're accomplished, they're ambitious, but they're torn. And they're looking for answers, not symptoms, not prescriptions necessarily. They're looking for answers. And I guess that's what I'm trying to provide in this practice, because I see that as a niche gap in what healthcare can provide today. In my day job, I actually practice as a forensic psychiatrist in a state hospital. And I treat those patients who have committed crimes but have been adjudicated what we call not guilty by reason of insanity, which means that they are deemed by the law not to have known what they were doing by virtue of the severity of their mental illness when they committed severe crimes such as murder, manslaughter, assault. The reason why I think it relates to my evening practice is because really it's about the story. How did such a thing happen? How could such a heinous thing happen? How could such a bad thing happen? And to explain to the courts, families, and even to the patient how their behaviors were dictated by their symptoms, their disorder, and the fragmentation that resulted. Anxiety is a universal emotion. Nowadays, it's probably the commonest disorder that psychiatrists address and treat. Unfortunately, nowadays it's been categorized into so many different disorders that it's become practically an alphabet soup of different labels and diagnoses that have become practically confusing for the patient and even practitioners. In reality, most anxiety disorders merge into a spectrum of different symptoms. And the art of psychiatry is to be able to tease these apart so that you're really providing meaningful help to the patient. Part of this is identifying patterns, part of this is identifying the cause, and part of it is identifying the patient's story as to how it affected them. Therein lies the art of doing psychiatric work on a daily basis, whereby you have to tie all these loose ends together to make the patient feel as though there's something they can understand and actually address so that they can get the relief that they seek. Helping an executive with anxiety is a multi-layered process, a bit like peeling the layers of an onion, so to speak, in that there are several factors that contribute to it that all have to be teased apart. For example, people who are highly accomplished typically come from backgrounds where accomplishment and achievement are highly prized. Hence, there are expectations inculcated in them from their parents, or themselves, or the culture at large, which expects them to go all the way to the top. Unfortunately, those are also precisely the ingredients that lend themselves to anxiety symptoms, when such achievements or results are not achieved in a way or in a manner or in a timeliness that's acceptable to the person, the individual, or the organization. I think the reminder, the realization that you are certainly not alone, and you are probably struggling with probably one of the most common anxieties or angst or disorders afflicting society. Knowing that, it should be easy to reach out for help, because you're certainly not going crazy as you might think, or losing it, because many people are probably in your position right now and actively seeking help, receiving it, and benefiting from it. I think psychiatry today is going through a bit of an identity crisis, in as much as it is on the one hand trying to understand patients. On the other hand, with the present system, it doesn't allow itself the time to spend with patients. So, for example, you hear the chronic criticism of the 15-minute med check, where the patient comes in, the doctor doesn't even look at them, gives them a prescription of medication, and the appointment is over. Coming from my background and training, I find that antithetical to the way I even think, let alone practice. For me, if I do spend the requisite time needed up front, I'm likely to help the patient, because I'm likely to get the most accurate diagnosis that is required in order to begin proper treatment. That means really connecting with them. It means not just reading off a list of potential symptoms listed in our diagnostic and statistical manual, but it also means finding out the story so you can get proper context. Once I've done that, I can be able to look at the full range of tools that can genuinely help the patient, be it medication, be it therapy, be it both. But in any case, a relationship at that point has been established whereby the person feels understood. That's extremely important. As often told to me in my training, a problem shared is often a problem halved. I think, like anyone, one's hobbies are the antithesis to what one does in one's daily work. So if one is rushing from A to B in work, one's hobbies would usually involve not rushing and enjoying time. For me personally, I enjoy my time when I'm able to think and reflect, typically through novels, through friendships, through sports such as chess, or simply just going walking with my wife, in the evenings. Whatever allows me to think and reflect deeply without any preconceived notions is what I would actually construe as my hobbies.